Hello, my name is Graham Hankey. I'm a professor of neurology at the University of Western Australia and a neurologist in the Sir Charles Gardner Hospital in Perth in Australia. The term stroke can have several meanings. It can be used to describe a sporting stroke or a tactile stroke or a stroke of luck. But today we're really going to be talking about no such thing. We're going to be talking about stroke, which is an event that is caused by a sudden loss of function of a particular part of the body, which is due to a sudden loss of function of a particular part of the brain that subserves that bodily function. And this is most commonly caused by a lack of blood supply to that part of the brain, and less commonly by a bleed into that part of the brain. A transient ischemic attack, or TIA, is a mini-stroke where the symptoms of loss of function of the particular part of the brain are transient or brief and tend to resolve within a few minutes or hours, and usually almost always less than 24 hours, and in which there is no residual brain damage or vascular injury on any brain scan. Now, stroke is important for three main reasons. Firstly, it is very common. Stroke affects about 2 in every 1,000 people each year, and transient ischemic attacks, or TIAs, affect about 1 in every 1,000 people each year. As a result, about 1 in 6 of us will ultimately have a stroke at some time in our lives. Secondly, stroke is important because it is fatal in about 1/5 to 1/4 of people, and in half of survivors it is disabling. Thirdly, stroke is important because it is preventable in nearly 80 to 90% of all cases if we can recognise and modify the underlying causal conditions or risk factors that increase our risk of stroke. There are two main types of stroke. The less common one, in about 1/5 of people, is a bleed into the brain due to a ruptured blood vessel in the brain. And this is most commonly due to prolonged exposure to high blood pressure throughout our lives, because high blood pressure can damage the small blood vessels in the brain and make them weak and prone to rupture. Another increasingly common cause of bleeding into the brain in our community is exposure to alcohol and other drugs such as amphetamines, and also some of the compounds in cough and cold medications that can increase in our blood pressure. But the major cause of stroke is a blocked blood vessel to the brain, causing what's called an ischemic stroke, where there's a lack of blood supply. And the most common causes of an ischemic stroke is embolism, or breaking away of a blood clot from the heart, which may be diseased by an irregular heartbeat called atrial fibrillation or a previous heart attack. The other common cause of ischemic stroke, where there's a lack of blood supply to part of the brain, is embolism of clots that form in the arteries in the chest, the neck and the brain that supply the brain. And the most common blood vessel disease is hardening of the arteries, or atherosclerosis, or otherwise called atheroma. So how can we reduce our risk of stroke? The first thing is to be able to assess it, and we need to know whether we have risk factors for stroke. The most common risk factor for stroke is high blood pressure. This is the cause of about 1 in 3 strokes. We all have a blood pressure, and the average blood pressure is about 120 millimeters of mercury systolic and 80 millimeters of mercury diastolic. For every 10 millimeter increase in systolic blood pressure and 5 millimeter increase in diastolic blood pressure, the risk of stroke increases by about 20 to 30%. So if we can reduce our blood pressure by just 10 systolic and 5 diastolic, we could reduce our risk of stroke by about 30%. The ways we can lower our blood pressure is by not adding salt to our diet, eating foods that are low in salt content, reducing the alcohol intake, and also altering our lifestyle in terms of increasing physical activity and reducing our body weight to an ideal body weight so that we're not overweight or obese. It's also ideal if we can endeavour to reduce the psychosocial stresses in our life, which can also increase blood pressure, but that can be easier said than done. The second major risk factor for stroke is cigarette smoking. The third is an increase in fats in our blood, and the most well known of those is cholesterol, and we can reduce the cholesterol levels in our blood by reducing the saturated fat content in our diet, the trans saturated fat content, and the caloric intake in our diet, as well as increasing our physical activity and maintaining an ideal body weight if possible. The fourth major risk factor is diabetes, which is inherently associated with being overweight and having high fats in our diet. The fifth main risk factor is atrial fibrillation, or an irregular heartbeat, that is increasingly common and now probably the most common cause of stroke, and that is caused by high blood pressure, which damages the heart, or blocked arteries to the heart from atheroma. The other major risk factors for stroke are alcohol excess and psychosocial stress. These are all modifiable risk factors. There are some additional risk factors for stroke that are unfortunately not modifiable. They are our age, our sex, our race and ethnic group, and also our genetic makeup, and so a family history of a previous stroke or heart attack in members of our family is an indicator that we may be genetically predisposed to high blood pressure or high cholesterol or a high risk of stroke. So the first step in reducing our risk of stroke is to be aware of what is our risk of stroke, and fortunately the stroke riskometer allows us to access this information in a user-friendly and easily accessible way. The stroke riskometer allows us to enter our non-modifiable risk factors such as our age and sex, race and ethnic group, and also our family history of stroke. And it also allows us to enter our known modifiable lifestyle risk factors for stroke, such as whether we smoke, what our alcohol intake is, and also whether we have stresses in our lives. There are some additional factors that the riskometer will ask, and that is our blood pressure and perhaps also our cholesterol, history of diabetes and fasting blood sugar. It may be necessary to attend your general practitioner to obtain measures of your blood pressure, cholesterol, fasting blood sugar and hemoglobin A1C, which are markers of diabetes or risk of diabetes. The stroke riskometer allows us to calculate our absolute risk of having a stroke over the next 5 years and 10 years from these known risk factors. It will also produce an estimate of the relative risk of stroke compared to someone of the same age and sex as us. The additional feature of the stroke riskometer is not only that it calculates absolute risk and relative risk of stroke for us, but it also allows us to self-manage our risk and see how we can alter our risk by altering our lifestyle risk factor behaviours. So there are two components to it. Having assessed our risk, it is then up to us to implement changes to our lifestyle and reduce the salt in our diet, the alcohol intake, obtain a regular exercise program, obtain an ideal body weight, and to minimize exposures to other drugs such as amphetamines and cough-cold medications. The important thing ultimately is to then monitor our risk and be reassessed, just the same as we would with our car. If we want our car to have longevity, we will take our car to a mechanic every 6 or 12 months and have it assessed and serviced. We should do the same to our bodies and take ourselves to our general practitioner each 6 or 12 months as required, and have our risk factors assessed, have our blood pressure checked, have our cholesterol checked, have our blood sugar and hemoglobin A1C checked, and also an ECG to check for atrial fibrillation. We can then re-enter these variables into the riskometer and see whether there has been a reduction in risk with the modifications to our behaviour. Thank you.